Gentlewoman yields back. The chair will now recognize the gentleman from Georgia, Mr. Carter, for 5 minutes.
Thank you, Mr. Chairman. And Mr. Chairman, I want to echo your comments earlier about what an outstanding panel this is. Thank you all for the very important work that you do. It is extremely important to our country, and we appreciate it very much. Dr. Bright, I want to start with you. Being, of course, from Georgia, I am somewhat concerned, even still, about the move of the Strategic National Stockpile and the management of that from the CDC to ASPR. And I just want to be assured again from you. I've met Dr. Redfield, and I think he's doing a great job. Dr. Schuchat and I have worked together, and I just can't say enough good things about the CDC and the outstanding work that they do for our country. And I just want to make sure that they're still going to have the opportunity to stay involved and to be involved in the medical countermeasure development and everything else that goes along with the SNS.
So you have my complete assurance. I echo your comments about the CDC and the great work they are doing. Many people don't know I got my first start in science at the CDC as an ORISE fellow, coming from Emory University in Georgia. I understand and appreciate the great scientific leadership of the CDC and their relationship with state and local and the value of that. And we plan to always include that in our assessment and our programs with the new Strategic National Stockpile Management.
We talked on it earlier. One of my colleagues had mentioned about the concern, particularly for that the transfer is not disruptive for the state and local agencies. How can you assure us? What would you suggest that we do to make that as the least disruptive as we can?
Well, the most important thing is to recognize the value of their voice in the entire process, not just in the transition of the management of the SNS, but an entire end-to-end process of our efficient response to any emergency or public health emergency threat. So we already have an intentional working group focusing on the state and local and tribal and territory partners and their specific needs and their specific interests to make sure those are encapsulated in our management of the SNS.
Great. Dr. Schuchat, would you care to comment on that as well? How can we assure that this is not disruptive to our local and state communities?
I think that change is by necessity disruptive, and I think our job is to mitigate that disruption so that people aren't harmed. So I think it's on our radar. We're working really closely together. The Association of State and Territorial Health Officers Board was just at CDC yesterday talking to us about how we can make sure this all goes as well as possible.
Let me ask you, I run the risk of being a little self-serving here, but wouldn't it make sense to look at perhaps just having ASPR co-locate down to Atlanta with the CDC? I mean, I recognize you're part of HHS, but we have to get out of this mindset that not everybody's got to be in Washington, D.C. I mean, we got a big country out here. Dr. Bright, I'm looking at you.
We have a big and beautiful country, sir, and I agree with you. And there is no intent to move the Strategic National Stockpile from Atlanta to Washington, D.C. There might be one or two individuals who are located in our ASPR's office to ensure we have smooth and efficient ongoing communication with the expert staff that is in Atlanta, Georgia.
Okay, well, that might be a good compromise, and we appreciate that very much. The Ebola crisis that we had, obviously it was, we learned a lot of lessons there, but I was so proud of the public-private partnership between Emory University and the CDC. And all 4 patients recovered. And I just wanted to know, will you be using that model in the future for other pandemics and other risks that we might run into? Because we're very proud of the work that was done at Emory University, and I think it's a great example of what we can do in the future. Dr. Schuchat?
I would say that CDC benefits tremendously from being located right next to Emory, and there's a really close working relationship. We were fortunate that they did such a terrific job in the Ebola, in the care of the patients there. There's ongoing collaboration and communication and support. I think ASPR may have more direct role in the hospitals and the care of such patients, and Dr. Bright might want to comment.
Yes.
I also want to make sure that we capitalize and not lose that expert and lessons learned from Emory University. As you may know, we stood up a national Ebola training and education center. It's based in Nebraska. It's a collaboration with Emory University, University of Nebraska,
right.
and Bellevue. It is an example of one of the finest educational centers on Ebola and other epidemic treatments in the world now.
Good. Again, I want to thank all of you for the work that you do, extremely important, and especially shout out to CDC and the work that they do. Thank you, and I yield back, Mr. Chairman.
Gentleman yields back. The chair will now recognize